We got to
Recording in
3.
progress.
You notice we started with the lower legs, and your notes there start with the feet. So what we're doing on the lower legs is just some long, smooth introductory strokes. And we always start off lighter, but you want to be heavy enough that it feels supportive. So at least a couple pounds of pressure. And notice I'm really like contouring the shapes of her leg. I don't want to, be like flat or bumpy. We'll study smooth flowing strokes a lot with Swedish massage, but it just feels really nice to integrate the lower legs into a foot massage. So we're just kind of getting started here. I use my hands together a lot. And I notice that the older I get, the more that I do that. I think when I was younger, I just tried to just use more strength. And now I am more using more relaxed and more support with my hands. But I'm really contouring all the way to behind her leg right now. And I already checked in with her, the first thing after seeing if there was anything I should know about what she needs with her feet. She had any injuries, sore spots, anything I need to know about. It was also to ask her, would she let me know if anything's ever uncomfortable or if she ever wants anything different. We want to ask that in a way that they're having to say yes and make an agreement on that. But we'll still check in.
Stephanie, we do have your question.
Questions so far? Notice that I take this work all the way out to the ankle and foot. And if, oftentimes your clients have really undressed and you're just draping them, we'll learn that later. But if a client has any clothes on, just be very careful that you're not getting lotion or oil on their clothes. So we got a hard stop up there by the clothes. Notice I'm gonna grab the stool with my foot so that I don't have to clean my hands again. And what you have on your notes are kind of some just sort of made up names of techniques that are good ways to warm up. And like it said in the videos online and the questions to help you practice with the videos, these can be integrated throughout the foot massage. So right now we're kind of learning them one by one just to kind of practice some techniques. But as we practice with different people and learn more techniques, you'll kind of learn how to make this your own. And whether you're doing a massage that has longer with the feet or shorter with the feet, you'll make little modifications. All right, so could someone please read the first step?
Says side to side, one hand on lateral side of foot, other hand on, how do you say that? Medial, sorry.
No worries.
Medial side of foot when done correctly. Foot should flap side to side.
Thank you. So it's like you're squeezing in like this into the inside of the foot and then pressing your hands together and moving your hands back and forth. Now, remember these tables move up and down and your stools move up and down. You can also stand, you can kneel, but a lot of people sit when they're doing foot massage, and that's okay. But just make sure that you're sitting as comfortably as possible, feet flat on the ground, your elbows or your shoulders are not up in your ears. And as you move side to side, you can really take that all the way up through the ankle and all the way back. Some people go for a faster floppiness, and you can really see and feel how the bones of the foot really get moving there. But it can also be nice when you're pulling to really I'm pulling now the leg out towards me, and that's called traction. So I can also get a traction motion going with this. Questions?
In this application, does traction mean what traction usually means?
What does traction usually mean to you?
I think of having something That's a really good question. My brain immediately went, you have traction, meaning like you're kind of like holding it,
Uh,
and so it's more of like holding and then pulling.
yeah,
Okay.
yeah. So in the context of massage, usually traction is referred like when you're slow and pulling, but I was referring to how I was really grabbing hold of these joints
Okay.
and pulling out. See the difference?
So it's
You
like
can
you're
feel-
pulling the skin with you.
And the whole bone, like, so
Oh, okay.
that movement is coming now all the way from your legs and hips
Right.
and all the way up from your head. Yeah.
Okay.
Questions? All right. Someone read the next one, please.
Diaphragm relaxation. Hand number 1, pull toes, flex over your other hand's thumb. Hand 2, work medial to lateral and work your way back medially.
This is not the order I do them in a massage.
No.
I'm like, I want to go to a different one.
I know, me too.
This is a weird order. All right, so this one, the diaphragm line is like, so the thick part of your skin or the sole of your foot, there's kind of like a where the skin changes from thick skin to thin skin. You can see and feel the change. That's the diaphragm line. So we're basically pushing into that border and then pulling the foot over. And you may notice that I'm supporting her ankle, and that may look kind of funny, but strangely enough, this actually feels good to support the person. So I'm not going to do this the whole time, but there'll be techniques where if you can't get good leverage, feel free to literally lift them up. And as long as you are very supportive about it, it actually feels good. What you don't want to be is all like floppy and insecure and they don't know if you're going to drop them, right? So I'm going to press and then pull into that. And then I lift up and move and press. You can probably unplug that for moments for better views. I feel like you could come over here for
I'll
this,
unplug this. Oh, I
yeah.
see.
The power. If you can come. A little bit. And how's that? Yeah, like more or less, or
Right here is good.
all right, perfect. Feel free to let me know anytime.
Yep.
So then I lift up, I move, I do it again.
Is it the end of your thumb that you're?
Great question. Yeah, pretty much great question. The end of the thumb. And I often like to support my thumb like this when I'm using it, so that I got pretty much a straight line here in this whole wrist. And I don't want to use my thumb way out here because then I'm stressing out this joint. And if you're just doing 1 or 2 massages, you might not feel it. But if you're doing a lot of massages, you want to be careful not to hurt your joints. So I got it supported. And that way, really, it's the strength is not coming from my thumb. My thumb is like a tool. And I can like literally use my whole body weight if I want.
I'd also like to point out that if your nails where your client definitely can feel if they're short enough or not.
Yeah, and then that's your job, right? To really fix that and not just like not use that technique, because there's a lot of techniques where we want to use our fingertips and our thumb tips. Now, if a client wants deeper than you can do with your thumb, or for whatever reason, you can try the same thing with this part of your knuckle or this part of your knuckle. Usually it feels awkward at first, but with practice, you can use these other parts of your hands very effectively as well.
So Stephanie, can you feel that my thumb?
Here's another little trick that if you rest your hand on a table, if you're using especially those other tools, that you can be stronger and more stable. What you don't want to do is be at an angle where you're trying to use your muscles funny and you're shaking. Usually if you're shaking, the person can feel it consciously or subconsciously. And oftentimes, if you just shift how you're using your body, you can get rid of that shakiness. And if you use this knuckle, you can also support your thumb that way. And then when you work your way out, you can do the same thing and come back this way. Now, notice I'm pulling the top of the foot down. Most people love this kind of motion. And so what you want to do is really feel into where this area is tight. And so that you're not just going through the motions of like moving the toes, moving the toes, moving the toes, but really feeling like you're increasing range of motion and working through those sticky spots when you do that. So really feel into it. And that might seem mysterious and it's just day one of lab and that's okay. But with practice, you'll really feel what's going on. So see how my thumb is supported, my hand is supported on the table. So I can use more strength and less effort. That's using leverage. And I'm going to sink into a spot that feels tight and then pull the foot into that tension. And how's the pressure? If we said 1 to 10 scale, 7's perfect, 10's too light, 1's too little, where are we at?
7.
All right, cool. That is the pressure scale we use in here. It's a made up pressure scale. You're not going to find the same pressure scale elsewhere, but if we all use the same one, it's helpful. Not everybody likes to work in numbers, but it's one way to practice being precise. Questions? I like to kind of reverse this technique too, because what we're really doing here is trying to get into the tissue and not go through the motions. So for example, it's tighter out here. So I can take the same idea of working with that area, but now just really push into, see how much movement I'm getting on the foot. And feel free to get up and walk around anytime you don't have a good angle of what I'm doing. All right. Can someone read the next one?
The way and one just on the muscles anterior surface and 2 both fingers together on top.
All right, so this one tends to baffle people. It's like Tai Chi, where your hands are going together. So we're going towards the client's head, towards the client's feet, toward the client's head. Try it in the air. It looks simple, but then when you're trying it, it might feel a little different. Perfect, perfect. You got it. Hula or Tai Chi. Now with the flat part of your hand or flat part of your knuckles and the ball of their foot and the other hand softly on top, supportive and contouring, we're going to press up and press back or pull and push and pull. Now you can stand up for this one and use your whole body. You could sit for this one. And you can feel where they kind of feel tighter. Usually people like you to push past that. Is that a good stretch? Yeah, more? More. Almost everybody wants you to push past that tightness, right? All right. Now, there's kind of 2 variations. I warmed up with flat part of my knuckles. People also enjoy when you use the knuckles to get into the tight spots. So now I'm using the knuckles and we're doing the same thing. Now, again, you can change your body mechanics. You can also like stand and really lean into it. And you want your hips facing the work. And you want your whole body to go with the work.
For that motion, it's important for the ankle to be moving and not just like ankle and tips.
Yeah, exactly. Yep, you're great. You're getting the whole ankle going. Yeah. And again, we're breaking these techniques down step by step just to teach you a few things to do. But within days, maybe even today, you're going to start really feeling into the work and really kind of making moves between one and the other, which are called transitions, where like I can feel with that last work that I did that pulling on the back of her ankle and really kind of opening up and, you know, kind of making that would be helpful, but we don't expect you to get there day one. So we're just going to teach you techniques by step, and every day we'll add some more, and then you'll get to where you can really feel into the work. Questions, comments? All right, would somebody read the next one, please?
Ankle loosening, base of thumb, joints in front of ankle bone and rock.
All right, so we're going to use this part of the base of our hands right here, base of thumbs, to lock into the front of the ankle here. And we don't want to slide on the skin. Stand up and move around anytime you can't see. And then we're going to go back and forth with our hands, not sliding over the skin, which is going to open up the ankle. Now, a really very nice part of this technique is if you then roll your hand around the base of the ankle to take this work all the way around the ankle. And you might feel some tight spots or some crunchies. Just
So it's
keep
more of a
going.
circular motion than just like rubbing back and forth on the ankle.
Exactly. And in fact, you really don't want to rub here too long, and especially right on the skin, but really open up the joints. And it's kind of like working with dough, like, you know, really get in there with your hands to open things up. All right, questions? All right, can someone read the next one?
For RLM, range of movement. Hand 1, under heel, left hand under right heel. Traction at calcaneus. And 2, number 2, rotate first.
Thank you. So one hand can really pull towards the massage therapist, pull back on the ankle. So you don't want to use much lotion or oil on this at all. In fact, I don't use oil on the feet, but you don't want to use much so that you can really get a hold of the ankle and pull towards you. And then the other hand is going to be moving the foot all the way up through the ankle around. Now, pay attention to what's happening with the knee and the hip. And you could see we can really get that motion going all the way up through the hips and all the way up. Motion a lot of people kind of miss is that this is very three-dimensional. So you want to make sure you get all the way towards you and all the way around. And notice that I'm really contouring the whole foot while I do that. And then you can go the other direction too. If you change your hands because it's easier for you, that's fine. And now I'm going to go the other direction. And again, range of motion, this is one of those things where people almost always want it further than you think. So don't take that first end point as your stopping point. They want to feel the stretch. They want you to push into it. Unless they had a recent injury or surgery in this area. And is that good? You want more? Okay. And if you can't get more, feel free to lift them up. And it's okay. Feel free to push with your whole body. So how's that? Okay, good. And then we're going to go around and towards and so forth. Questions?
Are you pulling? Are you rotating and just kind of assisting the movement?
When I push the top of the foot towards her head, I often pull from the calcaneus or the heel. And then when I do pull down towards me. Does that answer your question? Okay. Any others?
For the rotation, is it again the ankle that is? doing
Yes,
for you?
the ankle will rotate and then the hips will rotate. Yeah.
Is there any preference going one way or the other first? Or-
That's a great question. I don't think so. Not for this move. There are certain techniques where there's like different thoughts about clockwise and counterclockwise, but if you're going to go in both directions, I think you could start with either one.
And that's another question. Is there a reason? I mean, do you always start with one foot or the other, or there's no preference there?
Yeah, great question. There's, some different reasons you might choose one or the other. I would often, like, if I was massaging this leg first in the massage, I would often take the work right out to that foot. If somebody has more issues or pain or limitations and requests for something more on one side, like issues with their right hip, there's definitely a certain logic in starting with that foot first, to kind of start working with what they asked for, needing more help. And then if there's nothing like that going on and it's just a relaxation massage, some people think that the right side of the body is often less vulnerable than the left side of the body. So you might just start with the right side first. Yeah. But, you could, without answering too long, there's more things you could factor in, like injuries and so forth. Yeah. Any other questions? All right, is there another one?
Sandwich range of motion, sandwich top is dorsal, and bottom plantar of feet between hands.
Thank you. So you're getting the top of the foot and dorsal and the bottom of the foot plantar between your hands, squeezed together, and you're rolling your hands in circles so that you're increasing the motion between these joints. There's muscles in all of these spaces. And I'm opening my hands like this just so you can see the work better, and you can use different parts of your hands to get into those tight spots. But again, I often use my hands together now. And so feel free to use because you can get strength this way. And also I find I get softness this way. If I support myself, my hands together or my hands on my own body, I find I can be more relaxed and soft with it too. But what you're doing as you're going through this is you will find tight spots, and then you can use parts of your hand to really kind of work on those spots more. Now, there are a lot of bones on this surface, so you don't want to like bump into the bones. So in that sense, you're being more gentle with the top of the foot than the bottom of the foot. But don't be afraid of it because there's muscles in there and they get tight and they like being worked out. Yeah. Questions? Additions? Elizabeth, that was for you.
Oh, no.
I usually, when I'm in massage practice, I usually like to, after I do that one, I like to, usually I like to kind of get in there and really start twisting the foot and zeroing in on the spots that were tight. So that would often be my transition move. There's a very tight spot here. It might be tender. So when I start twisting the foot, I can check in. How's the pressure? You want
I
more or less?
actually had no clue until like you actually pressed on it. Like it feels a little sore. And I
Yeah.
had no idea that, but the pressure is good. Yeah.
Feel good sore? Yeah.
Pressure right there.
You'd be surprised. I did that last night and like slid out like all the aches in my toes. It was crazy.
Oh, nice. Yeah, a foot massage. Giving, receiving, even self foot massage. And okay, what's next?
Rib cage relaxation.
Oh, yay.
All
Transition to that.
All fingertips creep along top of the foot, one lateral to medial, one other medial to lateral.
All right, so there's some different variations on this. There's spaces on the top of the foot between the tendons, and you could sink right into those. Now, you can, variations on this technique, you can put your fingers like this and walk right through those spaces, or you can slide through those spaces. And again, there was this tight area here. So I want to really, people usually love this flexion motion. I really want to work through that tension.
You're just kind of putting your fingertips into like the valley between the, and then just kind of following them up.
Exactly.
You would be surprised how much tension.
Yeah, I had no idea until she like actually got in there that it's like, it's sore in there. Yeah.
Thanks for moving around. We often lift and take the camera off too. Just use the tripod when we can be stable. In the back, there's a thing to flip and lift. All right, so then I'm going to work through the other spaces too. And everybody, I highly recommend that you move around and you can see what we're doing.
Figure it out, sorry.
Oh, that's all right. And I'm just coming back to that one spot that was tight. And getting a little stretch. Now, keep your feet flat and keep breathing. It's really easy when you're learning new techniques that you're so focused that you're not breathing. And the client can feel the difference consciously or unconsciously. The more relaxed and breathing you are, the more relaxed and breathing they can get. So just check in with your breath regularly. I spent the first 2 years of my practice just focusing on my breath.
And you'll notice that for me, I don't think Zephyr does this quite as much as I do, but I rock back and forth on the table. That way, this motion is actually coming from my hips instead of just from my hands and my shoulders. So if I stay motionless, it's mostly coming from my shoulders and my upper body. But if I'm like leaning into it like this, I'm using my whole body to do it, and it's much, much easier.
And is that generally when you're doing most work, you're trying to like have your body moving instead of just your arms?
Yeah, for sure.
Okay.
100%. And you know, the one thing that's kind of funny about foot massage, because we do sit so often, is you don't see it as much, but you'll see it really obviously for all the moves where we're standing. It's the whole body. And it doesn't matter how strong you are, you still don't want to just be using your upper body or stand at like a weird angle where it's all your arm strength, right? I do upper body weight training all the time, and I do not focus on my upper body when I'm doing massage.
This body mechanics, the way that we use our body weight, is where the longevity in your career is going to come from, because you're not going to be, you know, like blowing out your shoulder from repetitive motion. That motion, that weight is coming from your feet, it's coming from your hips, it's coming from, you know, bigger joints that can take more wear and tear than like your little bitty thumbs.
And we'll be helping you with this all 9 months. Like every single technique we do, when we walk around and you're like working with your clients, we're there to help you, right? Just get better in your bodies. And it's never a criticism. It's just to help prevent injuries, of like how you can do the work even easier. All right, what's next?
I think that's the last one. Yeah.
All right, I'm gonna show you just 2 real easy things just to kind of integrate the whole thing and make it yummy. One is that don't forget the toes unless somebody has an issue with their toes that can't be touched. And so different ways to start including the toes is supportively around the toes, and then you can start really working through the toes. And I will show on this hand just for the camera that you're supporting the toes and then working through them. And then what almost everybody loves on their feet is lots of squeezing motions. So the squeezing doesn't always have to look like this part of your hand squeezing. Again, that's going to really hurt your hands and fingers and joints, just trying to squeeze like that, but that you're accomplishing the feeling of squeezing by using different parts of your hand. So like there's muscles in here and around this heel. We're just getting in there, and squeezing feels delicious and relaxing and stress relieving. And just try using all parts of your hand. Like most people like deeper footwork. So you're going to want to, right from the beginning, start using all the surfaces of your hands. And this may look rough. Just using my straight wrist, soft fist, so that I can be strong and use my whole body weight and get into her foot. Because if I try to do the same thing with my thumb and my fingers, I would hurt them. So, and how's the pressure? More or
A
less?
little bit more.
A little more.
And what you're doing is kind of like twisting.
I was gonna like, what, like, that's like a corkscrew, that's what I was getting.
Oh,
at,
yeah,
like
yeah, yeah.
Opening a bottle of wine.
Yeah.
Yeah.
I'm
Enough
opening
for
the
that.
wine. And how's the pressure now?
Good.
Good. One thing you can do when people ask for more pressure, because there might be a tendency to panic, like, oh my God, I can't, is to take a deep breath and relax in your shoulders and just change the position, your angle. So when she wanted a little more and I was using a flat fist, I just moved to a knuckle, took a deep breath, relaxed my shoulders, and sink in more. A lot of times we're not sinking in enough. And so when someone asks for deeper, we kind of like panic and just press more. But if you're not sinking into the tissues more, the person is going to still need it deeper. So let's take that same kind of squeezing motion. You can use all surfaces of your hands. People love their ankles squeezed. And I'm focusing on squeezing around her heel. And you can do that with different parts of your hand too. Now, technically, if you're really focusing right here with a lot of pressure, inside ankle is contraindicated if the person might be pregnant. I don't think you can hurt a pregnancy this way, but because people think you can, we just don't do it. In case they had a miscarriage, you wouldn't want them to think it was because of what you did. So may I continue that
Yes.
work? I don't really want to out you, but.
Oh, no. I did want to ask, like, it feels the same soreness as
Yeah.
you said, the tightness. Is
Yeah.
that a muscle or is that a muscle with a nerve?
Yeah. So it's probably muscle and fascia, and we're
Oh.
going to study fascia, but like basically the muscles connect to connective tissue.
Okay.
And they have nerves in them too, and they can feel the tightness. Yeah. So
You want to talk about crunchies?
do it. Or do you want me
Oh,
to?
I was gonna ask you to talk about crunchies.
So the feet are really interesting that they get a lot of these crunchy feels in them. And the crunchy feeling in the foot is usually different than the crunchy feeling in muscles. When you feel crunchies in the rest of the body, it is often like a sign of trigger points, and we'll study those later. But the feet, they just get these little deposit buildups of crunchies a lot. And a good strategy is to warm up. First of all, don't be afraid of the crunchies. The second thing, crunchies happen. And the other thing that works really well is to warm up the area. You really can't take the power cord out. And that shut the whole system down, huh?
Yeah, when I pull this out, it just
Yeah,
stops.
darn it. I'm gonna warm up an area. There's like a little crunchy right here. And then what you want to do is you want to keep working through it. You feel that little, yeah. So we're going to go like if the crunchy is right here, first of all, we're going to warm up the area, and then we're going to keep going from below it, through it, above it. And check in with the client so that you're getting a pressure that feels good to them. And if they don't know, a good guideline is that, you know, a lot of people like sort of like a good pain, but a good general guideline is that if they're tightening other muscles or holding their breath, it's too deep, even if they think they want more.
Mhm.
So that's just kind of good, because I get people ask me every massage shift, well, like how much pressure is good, right? So if they feel good pain, as long as they're not tightening other muscles, that's okay. And then we're gonna work through it like that. Little
like-
range of motion.
I like to call that the like hurts so good.
Mhm.
But there are a lot of clients who believe the like no pain, no gain. So they think that their massage has to hurt in order to be effective, and that's just not true.
All right, and there's some up here too, so I'm gonna do the same thing where I'm gonna push through them. And this is really a continuation of just the feet love to be squeezed. So every direction you can, and I'm using flat supported knuckles, every direction you can, just squeeze the foot. And we will spend more days with specific techniques, but I want this foot massage to feel yummy. And if you right away start incorporating squeezing and the toes, then your massage is right away going to feel better. So again, see how this angle would be really hard for me to get way down there. This may look funny, but it feels good to support their foot. I got my elbow on the table. I'm tripod holding their foot, and I've got her stable so she doesn't feel like she needs to help me. And then I can get to those areas I can't reach. Oh, there's another crunchy.
What is like a crunchy, like physically inside the foot? What is
It's
that?
physically some kind of deposit.
Is it kind of like a knot?
I
Kinda
also
like
know they look like
crystals.
nerves.
Oh, okay.
Yeah,
What did you call it?
crystals. What would you say is in a foot crunchy?
I usually, from what I've read, I usually think of them as crystals.
So it's just
So-
like a cluster of something? A
Yeah.
physical cluster?
Yeah, so like, let's try explaining it this way. Like everywhere in your body, there has to be just like tons of capillaries to keep taking out all the waste products from all the metabolic activities. And it's really easy, you know, just regular day-to-day activity, there's all these metabolic wastes. And it's easier for them to settle in the feet because all of that has to go against gravity
Okay.
to get cleared out. So we're helping get that, clear them out and get that circulation going.
So essentially like the capillaries, instead of taking the waste to like the outdoor garbage can, it's just like, I'll just put it outside the door.
Yeah.
So that's what it's trying to do.
It's like the kids leaving the empty cartons of food in the
All right. okay.
freezer,
Oh my God.
fridge and cupboard. Thank you for leaving the popsicles right there, the box with nothing in them.
And some of you may have heard of a condition called gout.
Yeah.
And that is also crystals, but those are uric acid crystals, and they're really sharp and painful, and they're
Yeah.
not the same thing as crunchies.
Yeah, and then people usually get the gout in their big toe and it's big and inflamed and yeah,
And
not the
super, super
same.
painful.
Don't worry. I'm going to teach you one more thing to make this start to be delicious is that if you feel the front shin bone, there's a part that has no muscle on it. You want to be to the lateral, which is pinky side of the toe to that, and get into that muscle and start rotating their leg, which is going to make the foot massage be a full body massage, because you can see how that goes all the way up to her hip. So we're going to get some stretching in there. So we're just going to warm up those muscles. I'm using pressure here, but you can see I'm using my whole body. And you can slow down to let them feel the stretch. And then we'll teach you a lot of different ways to end this, but I'm just going to kind of shake it out for today. And we are typically working with both feet, so you can shake out both feet. And usually we have sheets and or blankets. Usually we have both. And so if you finish one foot, something really nice to do, and you're welcome to use our extra sheets for this, is to actually wrap them up nice and cozy, because they're all warmed up and relaxed. And it's just that nice little extra yumminess that when you go to this foot, this one isn't sitting there getting cold. It's not necessary if you guys aren't using the extra sheet, but like in my practice, I always do that. We also have the hot towels at my practice, and so we actually do the nice little hot towel wrap too.
Oh, yeah.
And I tend to end with like a little foothold. It's just kind of like, I'll just pause a little bit. And just pull off. That way they kind of know, okay, this part is complete.
And you can do whatever foothold is comfortable to you and just take a few breaths. It may feel like you're not doing anything, but it can be very relaxing to the person to like integrate the work. All right, is y'all good there? Wow, thank you. So here's where we kind of have to, and could you stop
Can you
Zoom,
hit
please?
the
Thank you so much,
pause?
Gio.
You're welcome. Right
And,
there.